Hi everybody. Today we're talking about another one of my favorite subjects and a question. What to do when caregivers know more about dementia and Alzheimer's and memory loss than the health care providers and the people that are supposed to be out there helping you? This is a great question because with the prevalence of the diagnosis of dementia and Alzheimer's and memory loss, you would think that the healthcare system, or the care system at all, would train people in the system about how to interact and care for people with dementia. Because if you're a family caregiver, you know this is definitely a learned skill. It's not just something you wake up and you can do like that. I'm Pamela D. Wilson. My website is pameladwilson.com. I've been a caregiving expert for more than 20 years. On my website, lots of helpful information, online courses, my podcast with over 160 episodes, The Caring Generation. You can get a link to my Facebook support group. It's called The Caregiving Trap, my book, online course, a lot of information there. Please do press the buttons below. Follow my YouTube channel, share it with other people you know who are looking for hope, help, and support. And stay with me while I share things to look out for and a couple of scenarios that you might run into if you are caring for a loved one with dementia, Alzheimer's, any type of memory loss. So, number one, whether your parent is seen in a hospital emergency room, treated in a nursing home, receives home health care, has a paid caregiver, make sure, or at least ask, whether these individuals have any training taking care of anyone with memory loss. And I say that because otherwise, if they don't, you are going to need to show up to, believe it or not, supervise or educate them. Staffing issues today in all of healthcare because of COVID and how crazy things got, they're challenging. So honestly, I hate to say it, but just about anybody with two legs and who can pass a background check can get a job. Now, beware of this one. The state requirements for conducting background checks is a very low bar. I have a very high bar about what I expected from the agencies that I hired to work with my clients and the people that I worked with. So I will tell you that background checks on home health agency employees, sometimes nurses, people in other roles, very low. What my experience has been is that people who have criminal backgrounds who want a job can find a way to get around these background checks. I'm not going to tell you how to do it because I don't want anybody doing it, but they sneak into organizations and they take advantage of the elderly. And the other thing is because some companies are in such a rush to hire people, they hire them and then they do their background check and then they find out that they have a criminal background and they never get around to terminating them because you don't want people with criminal backgrounds working with the elderly. So anyway, trained or not trained in dementia care, we as professionals and family caregivers trust the healthcare system to have people to know how to work with dementia and be patient and kind and skilled. Well, it's not true. I hate to say it, but it's not true. Many caregivers know more than these people working in care communities. And this is super frustrating for caregivers because you need help. We all need help. So a couple of situations and what you can do, because you may have to educate healthcare providers who are supposed to care for your loved ones but don't have any dementia training. So your loved one goes to a hospital emergency room. I recommend going with them because the doctors and nurses working in the hospital emergency rooms are used to crazy things like heart attacks and broken legs and strokes and car accidents and things like that. They're not skilled at dealing with old people, the elderly, and very few are skilled with dealing with dementia. So in this case, it's up to you to be that advocate because if you can't be there, your loved one in the hospital emergency room with dementia certainly is not going to be able to answer their questions. They're not even probably going to be able to tell them what's wrong or what happened because they won't remember. So if you can't be there, call a friend, call a neighbor, call somebody that you know who can go down there. And you get on the phone and speak to the doctor and give them all of the history. Now, this is assuming that you have a HIPAA release, Health Insurance Privacy Portability Act, or you're your parent's medical power of attorney, or you're the guardian. If you're not and you don't know about any of this, go to my website, pameladwilson.com, How I Help, How to Care for an Aging Parent. I think it's Module 6, How to Care Plan for a Parent with Dementia. A lot of help there. Next, if your parent is admitted to the hospital, again, depending on how advanced their memory loss is, they may need a constant companion. Your mom or dad is going to be confused by this place with all these beeping noises and these bright lights and these people coming in and out that they have no idea who these people are. They may try to pull out their IVs. I had clients who actually did that. I had clients who couldn't feed themselves, and a tray of food would come in and it would sit there for hours and get cold, and my client would never eat. I had to hire caregivers to go sit with my clients who were in the hospital. Leaving a parent alone in a hospital or any type of care situation is like leaving a baby on the street and hoping that they're going to be able to take care of themselves. Doesn't happen. Older people, our loved ones with dementia, with advanced Alzheimer's, have no ability to advocate or speak up for themselves, and in many cases even take care of their basic needs. And the hospital staff, who has no experience with dementia, thinks that they're like the rest of us, like they're like everybody else. Well, they didn't eat their food. They must not have been hungry. It wasn't, they never think of like, well, gee, maybe they need somebody to prompt them or somebody to help them eat or talk to them while they eat. Crazy, right? Scenario number 2, your parent is in an assisted living community or a nursing home. If that's the case, again, be there as much as you can. Hire a caregiver to check up on them. When I had my clients in these situations, I would show up, my staff would show up, we'd check on them, we would make sure that things were going okay, because again, these poor caregivers, God bless them, many of them have such good, amazing intentions. They are not trained. So be sure to ask the people who administer these communities, they're usually called administrators or executive directors, how much training the staff actually has. And it's okay to ask the caregiver to say, hey, have you worked with people with Alzheimer's? Have you worked with people with memory loss? What's your experience? And as you will find, experience with dementia is a relative term. Experience to one person might mean, yeah, I saw a movie, I watched The Father, or Still Alice, or I saw The Savages, or The Notebook on television. Yeah, I know all about dementia. Well, not true. Even a caregiver who has a little bit of experience might not be up to the task. I had a caregiver one time take one of my clients to the grocery store, and she lost my client because she didn't realize that my client had just met her. She would never remember who she was or even what she looked like or her name, right? Caregiver wanders off into the next aisle. My client walks out the door of the grocery store, gets into a taxi, thinks she's going somewhere. Fortunately, she had a cell phone with speed dial. She called her sister. Her sister called me saying, oh my God, my sister's in a taxi somewhere in Denver, Colorado. Where the heck is the caregiver who's supposed to be watching her? Okay, this kind of stuff happens, guys. I was a professional care manager for 20 years, a power of attorney, a guardian for about 11. I found myself in the position of having to train most of these caregivers and most of this staff who worked with my clients because their organizations did not offer any training. So this may be something that you have to do as a primary caregiver for your loved one. And you're thinking, oh my God, more work, right? Pain in the butt. Why do I have to do this? Well, that is a great question. And I don't want to scare you about being involved with the healthcare system and people who have no training in dementia. But I do want you to be aware that just because a person occupies a job title or a position, honestly, doesn't mean they're qualified to take care of someone with Alzheimer's or dementia. Caregivers of people with dementia are really special people. You know this because you are a caregiver, probably of someone with dementia. And this caregiving job is not for everybody. So when we look at even primary care doctors, many of them are not trained with dementia care either or in dementia care. This is why 50% of the people who have dementia out there on the streets who go to a primary care doctor are never diagnosed. There are specialists for this. So my recommendation is if you have a person who has memory loss in your family or you're caring for them, get as much education as you can. Consult specialists where you can. So medical specialists are like geriatricians, neurologists, neuropsychologists, neuropsychiatric care, Make sure that you talk to people who really understand, and never be afraid to ask questions, because something that you know from your experience might not be something that they know, and you know way more about the people that you're caring for than they do. So don't always just take their recommendations at face value, because it may not work out the way you think. As the primary caregiver, you are what I call the gatekeeper. You're the advocate for your person, because they cannot advocate for themselves. You've got to be the one who asks the questions and who gets the education and who knows how to navigate all of this kind of stuff so that your loved one gets the best care possible and does not suffer from any type of unintentional neglect or people not paying attention to their needs who are helping you out to care for them. Because as a caregiver, you can't do it everything. I know you'd like to. I know we'd all like to protect the people that we care for because we love them. But caregiving is hard. It's exhausting. It's mentally exhausting. It's physically exhausting. Caregivers get sick more than the people that they care for. So find help, seek help, educate the people that you want to have you, that you want to help you care for your loved ones if you have to. You're the caregiver. You're the only one that can do it. And I know that you can do it. I'm Pamela D. Wilson. Please go to my website, PamelaDWilson.com. Hundreds of articles, hundreds of videos here, actually over 800 on my YouTube channel, my online course, all based on my 20 years of practical experience doing this work in the community. Thanks for being here. Have a fabulous day today. I will see you all again soon in another video.